The presence of an energy source is an indispensable and ubiquitous part of the OT armamentarium. Surgery without the use of an energy source is unthinkable and unimaginable. But how much do we know about these energy sources? Because without a working knowledge of its principles, the use of these energy sources is fraught with danger. In this lecture and subsequent 4 lectures, we will be covering the common energy sources which you can find across the operation theaters. The most common, the electrosurgery, the modifications of electrosurgery, including the argon beam coagulator, the PK tissue management system, the NSEAL system, the Lagasure system, the radio frequency ablation, microwave ablation, the use of ultrasonic energy, the use of lasers, cryotherapy, and finally the high velocity water jet dissection or hydrodissection. But first, let's go back in time. Remembering the evolution of human system. After all, why do we need an energy source? We all know that bleeding has been the bane of surgery from time immemorial. But not only the bleeding, of course, that is the main concern that we have, how to stop the bleeding. But apart from that, even dissection, a bloodless dissection also needs an energy source. Now, if you look at the history of how the methods evolved for stopping the flow. In ancient times, if you look at the Greek, you look and you'll find medicaments, antimony, copper sulfate, our own Indian past, where they tried elevation, cold, compression or pressure, and hot oil. Hot oil was a very favored method of stopping bleeding, which was used until the late 19th century. Carbolic acid was also used for its blood stopping the blood flow properties, and then came electrocautery in about 1875, and this was basically used for coagulation of the bleeding points. But the energy sources came only in the early 20th century. That's the early 1920 was the first time an energy source related to electrosurgery was used for the first time, and since then it has kept on evolving. Let's look at the famous dictum of physics. Energy cannot be created or destroyed, but it can be converted from one form to another. We all know that. But before proceeding with energy sources, let's look at what does the temperature do to your body. If you have an elevated temperature beyond your normal 37 degrees centigrade, what happens to your tissues? As soon as the temperature crosses 44 degrees centigrade, tissue necrosis starts. 50 to 80 degrees centigrade, coagulation occurs and collagen is converted to glucose. The temperature creeping up to 100 degrees centigrade, beyond 80, total desiccation or drying of the tissue. Desiccation here basically means drying of the tissue. 100 degrees and beyond, up to about 200 degrees centigrade, you have tissue vaporization. But at 200 degrees centigrade, you start having the carbonization of the tissue, and which is visible as a shower if fulguration is occurring. Now, if you look at these temperature gradients related to the common energy sources that we are using, the harmonic gives a temperature of about 80 degrees centigrade under optimal conditions. We'll talk about what optimal conditions basically mean. The laser gives a temperature of 200 degrees centigrade, while your electrosurgical machine gives a temperature of almost 400 degrees centigrade. On the other hand, what does decreasing temperature do? You have a temperature of 4 degrees centigrade and below, the tissue freezing and post-thawing vascular endothelial damage is evident. Tissue freezes and then it thaws. When it thaws, there is endothelial damage. That vascular endothelial damage will then lead to thrombosis and cell membrane dysfunction. The temperature goes up to minus 195 degrees centigrade, which is the temperature for cryotherapy. You have both formation of ice inside the cell and outside the cell. So intra and extracellular ice formation, the cell dehydrates and it shrinks. Subsequently, when the temperature starts rising again, or you have a subsequent thawing, the melted extracellular water rushes inside the cell and that cell bursts. Argon and helium gas under pressure are the most common gases used for the freezing thawing cycle. Nitrous is also one of the methods of using hypothermic means. Risks of internal bleed, infection, and nearby structural damage are all inherent to the use of hypothermia. Now, let's talk about the most commonly used energy source right from early 1920s, even today. The modifications are there, but its use has not changed. It is still an integral and a very, very essential part of every operation theatre. It is a very, very hazardous procedure. Remember that. And that's why it needs to be carefully understood and respected. It's not to be feared, but you have to respect the electrosurgical unit. Now, if you look at the types of electrical currents in clinical usage, because electrosurgery is what? It's basically electrical current that you're using. Now, what are the types of electrical currents in clinical usage? One, a direct current, which is commonly used in acupunctures for endothermy and the electrocautery. Alternating current, which is the most commonly used form in the electrosurgical unit that we use. The pulse current is usually a part of the electromyography examination and nerve stimulation. And in these, when you have pulse current, extremely high amount of electrical energy discharged in a very, very short time in nanoseconds. So that is a pulse current. Now, you go to any operation theater and the typical, when they want energy source, the typical command would be put the cautery on, right? Now, is that the correct term? No, it is not. Electrosurgery is the correct term. But why? Why it cannot be interchanged with electrocautery? Because more often than not, it is electrocautery which is the term which is more commonly used, and they use interchangeably. But that is not correct. Electrosurgery and electrocautery are two distinct entities. They cannot be used interchanged. They cannot be interchanged. Now, what is an electrocautery? Being used since 1875. There was a time when it was used for the first time. So 1875, right? It derives from the Greek word kauterion, which means hot iron, and the object or the iron, whatever object is being heated, is heated by a flowing direct current. But the current never flows inside the body. It never flows inside the body. The current heats that particular iron or whatever you're using, and that heat is transferred to the tissue. The current is never flowing to the body, and it can only coagulate, it cannot cut. So that is the electrocautery for you. More of it in the subsequent slides. But what is electrosurgery? Now, electrosurgery is the correct term that we use, what we normally use for the coagulation or for cutting purposes when we are using a machine which we commonly term as electrocautery, which is wrong. So it should be electrosurgical unit. Started in early 1990s. Alternating current flows through the tissue. Sorry, this should not be 1990s, early 1900. Current flows through the tissue, inducing intracellular oscillation of ionized molecules inside the cell, which results in elevation of intracellular temperature and tissues are heated. It's also known as a radio frequency current. You may come across another term which is known as the BOVI. Now, what is a BOVI? BOVI is still used to refer to an electrosurgical device or even the act of performing electrosurgery in general. But why the term BOVI? The name comes after the Harvard physicist William Bovie, who in 1920s developed the first innovative electrosurgical unit providing both cutting and coagulation. So that was designed by him, and the first clinical usage of this machine, or the Bovie machine, was by Harvey Cushing on 1st October 1926 in neurosurgery. Okay, so just to repeat, this should be early 1900s. This 1990s is a misprint. Okay. Now, so coming back to what is electrocautery, which we commonly use interchangeably with electrosurgery. Where is the cautery machine? Put the cautery on, press the cautery button, so on and so forth. So this is basically what we're talking about is a thermal cautery. Why? Because it heats and that heat gets transferred to the body. A direct current passes through a resistant metal wire electrode which generates the heat. That heated electrode is then applied to the living tissue to achieve hemostasis or varying degrees of tissue destruction. Okay, now temperatures of 100 to 1200 degrees centigrade can be delivered through loops fine tips and needle tips. So these are the things which can be, or these are the pros which can be used for passing on the heat to the body. You can use a loop, you can use a fine tip, or you can use a needle tip. Now, what are the advantages to be preferred in those patients where electrosurgery may be slightly problematic? Like, for example, a patient who has an implantable electrical device like a cardiac pacemaker, or the patient has got a wet field. We all know that the electrosurgical unit that we commonly use cannot work whenever there is wet field. We have to dry the field, only then the current passes into the body. So it can function even in wet field. There are two advantages of a electrocautery. And where is it commonly used? In strict terms, when you call electrocautery, you will find it in minor surgical procedures, used in minor surgical procedures of dermatology, like for example, angiomas, granuloma pyogenicum, vitiligo, in ophthalmology, including for punctal occlusion or the dry eye syndrome, otolaryngology, plastic surgery, urology, vasectomy, etc. So these are some of the common uses of electrocautery, but that is enough about electrocautery. Let's come back to what we talk about electrosurgery. Now, before we go into electrosurgery, we have to understand the electromagnetic radiation. Now, electromagnetic radiation can be defined as a radiation that has both electric and magnetic fields and travels in waves. Or it can also be defined as flow of energy at the universal speed of light through free space or through a material. That means either it travels free in the space or it passes through a material medium in the form of electric and magnetic fields. And what are the components? The components are here. So right from the lower wavelength, the low frequency, the radio waves, the microwaves, the infrared, the ultraviolet, the visible light here, and X-rays, gamma rays, they all together form what is known as the electromagnetic radiation, which can be divided into two types, the ionizing part and the non-ionizing part. The ionizing part is the part of it is ultraviolet, is ionizing, and of course the X-rays and the gamma rays are all ionizing forms of electromagnetic radiation. But here what we are talking about is the high induced current. This is the part which we are talking about, the radio waves. I told you radio frequency. I'll just tell you why electrosurgery is also known as radio frequency currents, and the microwaves and the infrared. So this is basically the area that we are talking about. This is the wavelength we're talking about, and this is basically the frequency that we're talking about. We talk about frequency of almost 1 megahertz to going up to what 50 gigahertz or even 1 terahertz. So that is a very high frequency we're talking about, right? Now let's focus on what we commonly use in the operation theater, electrosurgery. Now, if you look at the electrosurgery unit, that's there everywhere. Everybody knows the electrosurgery unit. So we are talking about a unit which is using a radio frequency or a RF current. The wattage, these are some of the important parameters, and you should remember these parameters. The wattage, it peaks up to 300 watts. Peaks basically means it can deliver 300 watts of power to you when you're pressing the pedal. But for cutting, an ideal would be between 50 to 150 watts, and for coagulation purposes, 30 to 50 watts is what is required and is enough. You never require a 300 watts output. The frequency of the current that is coming out, it has to be higher than 1 lakh to even as high as 500 lakhs to about 30 lakhs or hertz. This is basically the hertz we are talking about, the frequency. This is important. Why is it important? Because at this high frequency, there is minimal amount of nerve and muscle stimulation. So you don't get that shock. The patient doesn't get the shock. And it leads to more predictable and controllable electrosurgical tissue effects. And that is why this high frequency is required. The voltage that the machine provides is about 300 to 10,000 volts. Again, it is peak to peak. That doesn't mean you're using 10,000 volts. You're using somewhere in between. Okay, the duty cycle basically means that it is how much time it is on, how much time it's off, or the waveform or on or off time, which we'll define in the further slide. Amperage is the amount of current that is flowing inside the body, and if you look at these comparative figures, 1 milliampere is barely perceptible, but 16 milliampere is the maximum current an average man can grasp and let go. That basically means that if you receive a shock, you can let go of that wire. That is at 16 milliampere. Beyond that, you cannot let go, and you have paralysis of respiratory muscles, ventricular fibrillation, and at 2 amperes, there's a cardiac standstill and internal organ damage. Now, these figures are important. I think you need to remember the settings of an electrical unit. Now, understanding these terms, We all know from our old knowledge of physics the watt, the volt, the ampere, so on and so forth. But just to draw an analogy, a water pipe connected to a tank is basically a wire which is connected to the output, your electrosurgical unit. So what is the voltage? Voltage is equivalent to the water pressure at which the water is flowing. So here it is the pressure at which the electricity flows in the wire. That means 110 watts, 220, 240 watts. You regularly see, you have appliance, you will read on the 220 volts only, 220 volts only. Or you have one from the US, you will find 110 volts only. So we are basically talking about the pressure at which the electricity is going to flow inside the wire. The current or the amperage is equivalent to the flow rate at which the current is flowing through the circuit. That means the water is flowing through a pipe at the rate at which it is flowing would be similar to what is amperage is all about, right? The number of electrons moving through the wire. Resistance is like the pipe size. So if you have a large pipe, the flow would be reduced. You have a narrow pipe, it will be much more brisk and go much more far. Similarly, if you have a wire which has got more resistance, the flow of current would be hampered. The wire has got less resistance, the flow of current will not be hampered. Wattage, what is the wattage? Is the amount of power, total power an electric device consumes. Now you have those bulbs, see? Use a 20 watt bulb, you have a 60 watt bulb, 30 watt bulb. So these are basically telling you the total amount of electricity which is being used when it is on. That is electricity at work. So that is the power it takes to actually do something, right? So this probably will help you to understand better what we are talking about when we talk about electrosurgical unit. Now current frequency, I told you, it should be more than 1 lakh. Why? The comparative data is very important. Remember, now your household current, the current that flows in your sockets in the house, is only at 50 hertz. And what happens when you get accidentally electrocuted? You receive the shock of your life. That gives a severe electric shock. Now, why does that happen? Because nerves and muscles are sensitive because of the voltage related ion channels. That means the sodium and calcium channels. And that leads to what? Depolarization and polarization and gives you the shock. So in the muscles and nerve cells, these are the sodium calcium channels get activated by the alteration in the voltage and you get the shock of your life. That's known as the Faraday effect. But once you increase this beyond 100 kilohertz, this was 50 hertz, remember, 100 kilohertz or 10 to the 5 hertz, 10 to the power 5 hertz, this is 50 hertz, 10 to the power 5 hertz, or as high as 500 kilohertz, even up to 5 megahertz. So these are basically the equivalent figures I have given. The yellow is what I have mentioned out here. So this leads to what? A very, very rapid make and break. And that prevents the depolarization of cell membrane. The cell membrane does not get enough time to depolarize itself. The current is so fast in frequency. Comes, goes, comes, goes, comes, goes. So there's no depolarization. If there's no depolarization, there'll be no nerve stimulation, there'll be no muscle stimulation. And in addition to that, it also minimizes the water electrolysis, the new generation of hydrogen and oxygen bubbles, which would otherwise obscure the field. Now, that will no longer obscure your field. And number two, it will no longer electrocute you or accidentally or even the patient. There will be absolutely no shock to the patient because of the very, very rapid depolarization, because of very, very high frequency. So this comparative data helps you. From 50 hertz, we are talking about 10 to the power 5, right? That is what we're talking about, or even up to 10 to the power 6 hertz. Why is it called a radio frequency? I've been referring to electrosurgery as radio frequency current. Simply because the frequency which are used for the current that you use for the electrosurgical unit are around 500 kilohertz, right? And this is the frequency which is also used by the AM transmitters of radio broadcast. We all know that the radio, you have the FM mode, you have the AM mode. FM is only the recent one. When we were in our early infancy or in the early childhood, we never knew about FM. It was only amplitude modification. Now, the amplitude modification radio broadcast works at 500 kilohertz. And because that works at 5 kilohertz, so that is why the electrosurgical unit is also known as the radio frequency current unit, right? That's why radio frequency electrosurgery. Now, tissue effects is one. Now, I am using that electrosurgical unit. Now, what's going to happen to the tissue in the body? The probe is attached, touched onto a particular area. How does that affect the body? Now, when you're talking about the effects on the body, there are certain variables which would determine the ultimate effect at the site or the target where the current is applied. Now, what are those specific variables? Those related to the electricity which is coming from the surgical unit, namely we all talked about that, the voltage, the wattage, waveform or duty cycle, I'll talk in the next slide about that, the generator active time, that means for how much time your pedal is on. Yeah, the generator is on, let's say for about 1 second, or generator is on for 5 seconds. So obviously for 5 seconds it will be much more electricity passing to your body. And the current density at both the entry and return electrodes, I'll explain this further. Now, electrode specific. So these are the variables for the current that's coming inside your body. What about the electrode that is touching your body? That electrode, the size is small, there will be higher current concentration. The desired tissue effect can be achieved with reduced power setting. And if you have a larger area of the electrode, like for example, compare a ball electrode with a point electrode. A ball electrode has got a larger surface area, so obviously the current concentration at one particular point will be less. In a needle electrode, it will be much more high. Then how do you handle your electrode? Are you using a contact mode or non-contact mode? What this means, I'll just tell you. Dead tissue sticking to electrode becomes non-conductive. A dead tissue is non-conductive. Remember that. It doesn't pass electricity. So it requires a higher current. So machine says, look, I can't pass the current. Let me increase the voltage. So these are machines which can automatically increase the voltage. So more damaging to the body. So what is very important is, you must have seen when using the probe for electrosurgical unit, you have that on the tip of the electrode, you have that black attachments, the sedimentation. So you have to rub that. You have to rub that. You have to remove that. So this is nothing but the dead tissue sticking to that probe, right? Then the current cannot pass anymore. So once you clean it, the current starts passing again. You must have seen that when you're using a electrosurgical unit. Then there are tissue specific variables, namely the conduction and resistance of a particular tissue where it's being applied, the current is being applied, the tissue is wet or dry, and if there's blood or pus. Because in the presence of wet tissue, in the presence of blood and pus, the current does not pass from the electrode into the body. So that becomes resistance, right? So conduction resistance is very, very important when you're talking about the variables in that. Now, the electrosurgical unit, which we just now talked about the specifications, it is basically a solid state microprocessor controlled frequency generator. And it always generates an alternating and bipolar current. What does bipolar current mean? That means the current leaves the machine from one side and it has to come back to the machine from a different side. So it is bipolar. That means it has to have two poles, the positive and the negative. And when we talk about the generator that we use normally, see this electrosurgical unit we are talking about. The generator is the electrosurgical generator, the machine that is there inside your OT. So when using this electrosurgical unit, it can either be an isolated, in fact, it should be isolated. Initially, they were grounded generators. I'll just tell you what a ground generator means. The types of current return electrodes, either it can be dispersive electrode, that means the current, how is the current coming back to your surgical unit. Remember that plate which you put underneath the patient, that's very, very important. That is what is bringing the current back to the machine. Initially that used to bring the current into the earth. That way initially the term was earth plate, but that is no longer used. And the electrode types can either be monopolar or bipolar. We all know that. Now to explain these, now let's see what does bipolar mean. Now this is the typical electrosurgical unit. Now here what is happening? This is the dispersive plate, right? So the current coming to the patient and from the patient through a dispersive electrode coming back inside, right? Now that means this is an isolated generator. Isolated why? Because it is generating the current and is bringing the current back, right? Now what happens in a bipolar? Now this is basically a unipolar. This is monopolar. Why? Because the current is not being brought back by the same electrode. So it is only one pole in the electrode, so it is monopolar, right? Now what does bipolar would do? Now bipolar, see, this is one electrode and here what is happening? The current is coming from here and a very short course inside the patient, and the second prong of the electrode picks it up and brings it back. So here both the poles are there in your electrode, so this is basically a bipolar instrument. So monopolar, remember, is an instrument which only brings the current to your body. It doesn't take it back. Bipolar is one which brings both the current to your body and takes it back from the body, right? Now, in addition, so now we know what is basically a bipolar. So this machine is bipolar The electrode can be monopolar or bipolar. Remember that there's a difference between that, because every electrosurgical unit has to be bipole. It has to generate, it has to take it back. So here also see, the current is going from here and coming back. So both positive and negatives are here. Here also going and coming back. Both the positive and negative are here. So that's why electrosurgery is always bipolar. Here the term bipolar basically means the negative and the positive. Both are there inside the machine. What about the electrode? The electrode can either have one pole, so it will be a monopolar instrument. If it have both, it will be a bipolar instrument. Agreed? Now, there's another term which you should know about the electrosurgical unit and the application of electrosurgery to the human body, and that is open or closed circuits. Now, what is open or closed circuit? Open or closed circuit basically means that the electrode is touching your body, it is a closed circuit. But there could be an instance where the electrode stops here. I'll show you in the future slide. And the current has to pass through a minimum amount or some amount of air to reach the body. That is a open circuit, right? Open, why? Because in between, there's a gap between the tip of the electrode and the patient. Now, I told you about the isolated and grounded generator. Now, let's see what happened initially when the electrosurgical unit was designed for the first time. The current used to come from the generator to the tissue. It never went back to the generator. No. Where did it go? From this plate underneath the patient, it went to the earth. So at that time, it was known as the earth plate, and this was known as a grounded generator. Excuse me. Why grounded generator? Because the generator was generating a current which was going to the ground. So grounded generator. No longer used. That's why the big crosses. So no earth plate, no ground generator. What do we have? We have an isolated generator which sends the current, takes it back. And what is the patient? The patient plate is now would no longer be known as earth plate. It will be known as a dispersive plate, right? So you know the difference between the generators or the isolated and the grounded generators. Now, having understood that, the current enters your body through the electrode. Where does it go? And how does it reach the dispersive plate? That is very, very important. It always takes the path of least resistance. We all know that. Electric current always takes the path of least resistance. Now, tissue with high fluid electrolyte concentrations conduct electricity the best. And in that manner, it is in the form of maximum conductivity to least conductivity. You can go down the scale from blood, the nerves, the muscles, while bones are less and fat is the least conductive of all. Intact skin forms the first and a very strong barrier to current flow. Another point. Now, when you're passing a current from A, it should go to B to go to C. Is it as simple as that? No, never. It never takes a straight path, because once tissue desiccates, I told you, tissue dries up, it becomes non-conducting. So when I passed a current to B, this became desiccated tissue. Now it is not allowing any current to go to C. Now what is happening? Now what is happening is that the current takes an alternative nearby route, which would be a very, very circuitous route, in the sense that it would not be a straight route. It would become a route which you cannot predict. But what you can predict is it will be taking a nearby route, which would be a wavy route, right? So remember that the path is never straight. The changing resistance of tissue. Now, when this becomes desiccated, it is not passing any current. So temporarily, what is the machine trying to do? The machine is trying to force more current. So what is doing? The machine voltage increases sequentially by itself. But once it sees that it's not able to do so, then the current takes an alternative route. Now, when the machine voltage is increasing, it becomes more damaging, right? So once the current, okay, so that is basically, we have to understand that we have to be very, very careful that, remember I told you that there should be no desiccated tissue sticking to the tip of the probe. And number two, do not apply more electricity to an already charred area. You find that area is charred, you have gripped a tissue in an artery forceps and you keep on passing current. It has become black, you still keep on passing current. Now what is going to happen? It is going to become damaging. Why? Because the current is now going to flow by the side. Okay, so the flow of the current, when it flows inside the body, I already told you, because of the oscillation of the ions inside, is going to generate heat by resistive heating and conductive heating. So that heats the tissue and gives you the tissue effects of the temperature that we talked about. And remember, we talked about the temperature of reaching almost 300 to 400 degrees centigrade when you use an electrosurgical unit. Now the waveform, when we had talked about the variables in electricity, and one was the waveform duty cycle. What do we mean by duty cycle? Let's look at this figure. This is a low voltage current, continuous. This is an interrupted current, but the peaks are very high. So we are proceeding from a cut current to a pure coagulation current. So what is happening in a cut current? A continuous low voltage. In a coagulation current, an intermittent high voltage. Now, what does intermittent mean? Maximum time it is off. It is only 6% time it is on, 94% is off. So this is one of the machines, just to make you understand. So here basically you're looking at the blend mode. See, blend 1, blend 2, the cut and the coagulate. So when you increase this, you're increasing the voltage here. When you're increasing this, you're increasing the voltage out here. Okay. Now, what are the blend currents? The blend currents are in between currents where from 100% on to 6% on, you have a range of on and off. In pure cut, what is continuous? So on for 100% time. Until you press the pedal, it is on. Once you stop the pedal, it costs. So the pedal pressure would be leading to a constant generation of current out here. But here, even when you're pressing the pedal constantly, you're pressing it, but the current is only coming from 6% time, 94% automatically gets off, even when you press the pedal, right? Is that clear? So when you're putting in one of these blend modes, you press blend 1, so you're altering this percentage of on and off. So from 100% on, it changes to 80% on, 20% off, blend 3, 50% on, 50% off. So when you're proceeding from the cut to the coagulation, so these blend modes these are cutting currents with modified duty cycle. These are the modified duty cycle, 80-20, 60-40 and 50-50, right? So that is to make you understand what the duty cycle of waveform basically means. Now, the methods of application of current could be of two definable methods. I told you, one, your probe touches the body. Number two, your probe does not touch the body. So the first is what is known as the non-contact mode, which is a cutting mode where you use a low voltage current 100% of the time. I just now showed you in the last slide. Coagulation or fulguration. Fulguration basically means lightning. Lightning basically means what? Appears and disappears. Sudden flash of lightning and goes off. Similarly, out here in fulguration or coagulation, what is happening? 6% on, 94% off. 6% on and suddenly goes off for 94% of the time. So higher voltage, current only for 10% or less. In contact basically means the probe is in contact with your body. Desiccation is the only method by which the current can work. And this desiccation can either be coagulation or cutting. And this, remember, desiccation mode of an electrosurgical unit is the most common mode used by the surgeon. That brings us to a very important and very interesting feature. Now, when you are grasping a bleeding point with artery forceps, you ask your assistant or you decide whether I should press the yellow pedal or I should press the blue pedal. Now, you say I am cutting or I am coagulating. Are you really doing that? You're not. You're not. Why? Because if your probe or the contact point is in contact with the body, you are not doing any cutting or coagulating. You are using the cutting and the coagulation mode. So yellow denotes cutting current, blue coagulating current. So what is basically the interpretation? The interpretation is that when you're depressing the yellow pedal, when your electrode is touching the body, then you're using a low current constantly, and when you're blue, you're using high current and intermittently. That's why I said it is only in the non-contact mode of application. I'll just show you what this basically means. So this is basically what happens when you're just pressing the yellow pedal. This is what happens when you're pressing the blue pedal. Because when the electrode is touching the body, either through your artery forceps or otherwise, you're only desiccating. You're not cutting or you're not coagulating. You're using a cutting current, using a coagulating current, but you're not cutting, you're not coagulating. Remember that. That is very, very important to understand, right? So yellow pressed, low voltage continuous, blue pressed, high voltage intermittent current. Now, we've been talking about non-contact and cutting mode. So what do these really mean? Now, when we talk about non-contact, we are basically saying that your probe tip is never in contact with the body. This is the body, your probe tip is not there. So when you're using a non-contact, you can be using a cutting, you can cut the tissue or you can coagulate the tissue. Now continuous high current, I just now showed you the first figure. So here also low voltage. Continuous low voltage, high current basically means high amperage. Why? Because it's constant. The current starts here, keeps on flowing, flowing, flowing. So obviously it has to be high amperage. Continuous, yes. Low voltage, the voltage is low. So minimal depth and width of necrosis. Why? Because not in contact with the tissue. And tissue effect determined by the electrolyte size and movement. Tissue vaporization creates a local plasma cloud of steam, ions and organic matter. And to extend the zone of vaporization and complete an incision, the electrode is advanced, keeping its tip or edge and the target tissue within the plasma cloud or steam envelope. Let's see if we can talk about that in the, if I can run this. I'm sorry, this is not running. Okay, I'll show this at the end of the lecture. What the cutting and the coagulation mode means, right? Now, the non-contact application, the second is what we know as fulguration. Now, that fulguration, lighting, I told you, this was a term introduced by Keating and Posey as early as 1997. Here, what we're talking about, non-continuous. This is not continuous, so non-continuous, high voltage and low current. Why? Current is here only for this time and this time. So low amperage, high voltage, non-continuous current. And how does it coagulate? Coagulates by spray of electrical spark. See, it is spraying. The spray coagulation or black coagulation. Best for oozing capillaries or arterial bed. So remember, if you have a non-contact mode, whether you're cutting or you're coagulating, it is always going to be superficial HR and minimal damage. Why? Because your probe is not in contact with the body. There is an open circuit. It is away from the body, right? To make you understand, I'll show you that the picture in the later slides, right? The blend mode I told you is combination of cut and coagulate. These are the blend mode. So you can see the varying duty cycles and the varying voltage cycles and the varying amperage, right? So it is interrupted, pulse, high voltage current, no longer time, so longer time is required and more width of necrosis, more post-operative necrosis as compared to a pure cutting current. Now coming to the contact application, which we told you is the most common form of application. I'm sorry, the video is not running. I'll just show the video later on. Right. So the contact application is desiccation. That's what we know. And this is the most common method of usage by a surgeon. The term introduced by William Clark in 1911. Any waveform will desiccate if in contact with tissue. So here see the probe is in contact with the tissue. All electrical energy is going to convert to heat. Now, as opposed to the non-contact, part of the energy or the heat would be dissipated inside the atmosphere. Here what is happening? It is going to go into the body, all of it. So when you compare to the non-contact type, here all the electrical energy is going to heat the body, and that's why the damage can be much more as opposed to the non-contact where significant loss of energy occurs to the air. So in a contact form, the area of necrosis would be deeper and wider and would cause tissue sticking. The vessel tear during removal of cauterizing hemostat, mostly because of over desiccation. You must have seen it. You apply it to a cautery, and when you try to remove it from the body, the body tissue keeps sticking to it. You try to pull it out. So what is happening? That is basically the over desiccated tissue which sticks to the probe, the tip probe. And there is uneven necrosis, and the ampere meter or ammeter can help in confirming the endpoint so that you don't over desiccate, right? Now, this was the principles of electrosurgery, the physical principles, and this will be continued in the part 2 for this another lectures. You can log on to my website, and please do not forget to subscribe to my channel. Now, before going off, let me just show you what we are talking about. Okay, so showing the non-contact application. I'm sorry, during the lecture the video was not running. So you can see that there is minimal depth, but width of necrosis is high. You can see the sparking. Now this basically spark is because the current has to travel from the tip to the body with the intervening air. So that is creating a plasma cloud of steam. Now let's see this once again. So that cloud and a lot of smoke. So this zone of vaporization you have to keep the probe inside the zone of abrasion so that you can complete the cutting or the coagulation maneuver. This is known as the steam envelope. Now, that was the non-contact application we're talking about, which can be a pure cutting or a pure coagulation mode. Now, let's see what is the contact application. We said earlier that this is the most common form of application and the most common form used by surgeons. Here, the probe is touching the body. See, it is going through the soap. This is depicting the body. So this is basically in contact. When it's in contact, it is desiccating. Now see, the width is less, but the deep. See the depth. So the area of necrosis is deeper, much more deeper, and the tissue is sticking to the tip. Let's see this once again. So tissue keeps on sticking to the tip of the probe, and that is why it can often cause a vessel tear during removal after cauterization has been done when you apply it to a particular part. See the tissue sticking there. So this is basically an uneven necrosis as opposed to the non-contact where you have a even necrosis.